my screen?
I'm sorry, I'm back.
Okay.
Sorry about
I
that.
was scared. I was scared. He just finished explaining why he is the best candidate for this seat in this race. We're going to ask you the same thing. Why are you the best candidate in this primary for this seat? And be succinct.
And let me ask you something. Where is Raymond Molina, the
No,
other?
we do not know.
When he was invited, he accepted, and he's having problems logging in.
Is he trying to
But
log
he
in?
is.
Is he trying to log in? We have been in a lot of contact with him, and
Yeah, he's been trying.
so people who have made it and
Right.
not sign in, we'll have a phone call with him, a brief phone call with him later.
But he
So
will-
anyway, the question is, why are you the best? This is your second go round. Why are you the best
I
candidate?
remember you last time, yeah. Well, I believe that I am the best candidate because I'm the one who has most experience in the political realm. I was on television for 35 years covering the topics that affect District Number 27. And I believe that I have a grasp of what this community needs. Right now, the situations that we have with transportation, with senior housing, with climate change, with everything, and the economic aspect. And in reality, this district needs somebody that is ready to work with Washington, to work with a party that I belong to, and have the support from leadership, have the support from those people that can make a difference. And not only that, but having the knowledge of knowing what the District Number 27 residents and constituents need. And that's why I think I'm the most qualified.
Okay, thank you very much. Talk about those needs. I would like the two of you to talk about those needs using specifics. As you campaign in the district, what are you hearing from your potential constituents as to what the challenges are and how you would address them in in Congress? Specifically, pick two issues that you're hearing about and that you want to tackle in Congress. And be succinct, be brief, Mr. Fiol.
Well, I think the first issue that I would need to tackle would be Medicare for the elderly. It's a big issue here, and Obamacare has had a big impact on Medicare. It has taken a lot of money away from it into and given to as a subsidy to people who work, and I think that the elderly and those that are uh, you know, I'm sorry, are like military veterans, they need to have Medicare and the VA available and their funds available, not taken away from by Obamacare. I think that's number one. That's the number one issue that we have to face in this district. And another big issue is school choice. School choice is a big issue, we have to have money from the federal government to help us out with to help the local school board with school choice and getting vouchers so that students can not only go to whatever private school, public schools they want to, or any charter schools they want to, but they could also go to private schools. I think that is a big issue that we have to deal with. Those are two large issues, and of course, we have to deal with a lot of foreign issues because we as Congress people we deal a lot with foreign policy, and that's one thing that I think that Ms. Salazar and my other opponent also never really tackle, and that is Cuba, the menace that the Castro regime is, and the new tyrant that's there, the puppet of Raul Castro, Mr. Diaz-Canel. We have to deal with that tyrant. We have to deal with the tyrants in Nicaragua. We have to deal with the tyrants in Venezuela, because we as congressmen have to deal with foreign policy, and those people are sending over drugs in large quantities from South America, Latin America, and as Congress people, we're the ones that have to deal with that, and we are the ones that have to set that policy.
Okay, thank you very much.
But I think Mr. Molina is joining us.
I think he is.
Mr. Molina.
If you, I just would appreciate your patience, Ms. Salazar, Mr. Fiol. issues that you are hearing about as you campaign, and how you would work to solve them in Congress? What could you do?
I think that one of the most important topic right now is economics. After the pandemic, we have a serious economic situation, not only in 27, but all over Florida. And I believe that as a congresswoman, I need to go look for fiscal funds that are available and to make those funds available to our constituents and give them information. Information is power. And make my congressional district office a center of information where a small business can go and apply for those helps that are available for the small business. Not only the PPP, but there are many other programs where you can that you can apply that are there for small business. And for the individuals, the people that have the 1099s, for the Ubers, for the people that don't necessarily have the W-2 that can apply for unemployment, I think the way you can help them is that there are other retraining programs that are available, and only at the federal level, those individuals can have access. The federal level is the one that has access to those funds and to those programs, and then help those individuals directly. Also through the local officials, to the mayors of the different cities within 27. It's just basically making federal funds available at this hour to help those who do not have a paycheck and need to buy food and need to pay rent. That would be the number one. We can always talk about healthcare, we can always talk about senior housing, transportation, climate change. Right now, it's the economy.
Okay, thank you very much. Mr. Molina?
Yes,
Yes. Can you discuss two issues that are important in District 27 and how you would want to tackle them in Congress?
well, fundamentally, the District 27 is a district that has been neglected for years. You have all kinds of problems that are similar of importance. You have security problems in the neighborhood of Alaska. You have the environmental issues that are been neglected. You have the bay waters that are contaminated, and historically they have not been addressed properly with the intensity that it requires. The district is in total chaotic situation. The present congresswoman has not done anything in that district, and the previous congressmen have also neglected. So we have an accumulation of issues that all of them are as important as the other. So
Mr. Molina, can you pick two specific issues and tell us how you would tackle them in Congress?
Well, the most, I would say, it follows, they're all important thing, but let's say I would pick the contamination of the waters of the bay, and then the second is the security issue. People that are living in neighborhoods that they go to bed frightened because somebody's going to come into their house, that their cars are being vandalized. Those are two issues to me of extreme importance, because the contamination of the beaches, of the water of the beaches, has a direct economic impact on the economy of the district, because all of District 27 is the ocean, the most precious element that we have to bring money by tourism. So that has to be addressed immediately. What is it that is required? It's required going after the necessary funds and engineering to resolve the problem of old water lines that have been have not been replaced. We need water pumps. We need a series of engineering work Do I have a question?
Well, Louise is going to ask all of the candidates, all of you candidates, a question.
Okay.
If you were in Congress right now, would you be fighting for more stimulus money for the average American? I'm talking about the $1,200 stipend that people receive from the government. Are you for that or against it, Mr.
Well, there is a.
Well, Mr. Molina, go ahead. Yeah, go ahead.
There is an emergency that has been caused by elements that's out of our control. And I presume that I would be voting to assist the needed in being subsidized through this pandemic issue that we have. Definitely, we need to activate the economy. I don't believe in depending on the federal government to continuously aid, the people. I think that we have to change some of the rules that are being applied to the citizens and the businesses in the district and liberate them because we need to activate the economy. We can't continue to go to Washington asking for money because that pot is going to finalize someday and we're going to have a bankrupt country is what's going to happen. We need to advocate getting the economy rolling specifically and as soon as possible.
Okay, thank you. Ms. Salazar,
What was the question again, please?
if you were in Congress, would you be supporting sending more stimulus money to the average American? I'm talking about the $1,200 that many people received recently. Would you favor that?
I would favor helping the unemployment, the supplemental unemployment help or aid that the federal government is giving to the states. Here in Florida, we're getting $275 a week, and then if the federal government can give another $400, that would be around $675, $700 for those who are not working. But the moment that they could find a job, then we should stop those. So I believe that extending the unemployment help, that it will go to those directly in need, those that do not have a job. That's what I would do.
What about the cut from $600 to $400? Do you support that?
I would say that $400, you remember that it's $400 plus whatever the state is giving them. So in some states you have, in Florida it's $275. Maybe we should increase a little bit to $300 state, but in order to help those who cannot make ends meet with $275. But in New York it's $800. So 800 plus 4, so it depends. So it's you have to caliber what's the correct, and having one figure for the whole country is not, I think what should be done is that each state, specifically in Florida, and not only that, making sure that unemployment office in Tallahassee really works fast and good for those people that need that money. And at the beginning, we had issues that now are being fixed.
Thank you very much, Mr. Field.
Well, I'd like to say first of all, I haven't received my $1,200 check. I haven't received any check at all. I've been working all my life and never received a subsidy of any kind. I pay taxes every year, lots of taxes, and I haven't received a check. And quite frankly, I've kind of lost hope that I'm going to receive a check. Now, as far as the $600 a week, the problem with this is that many people aren't going back to work. I have many employers saying to me that they can't find any workers because everybody's on unemployment and they can't go back to work. So that's the reason why they cut the check from $600 to $400 to see that incentivize people to go back to work. I think a great solution would be to leave it at $400, maybe a little bit less, $350, and not penalize people for going back to work. In other words, they could get the $400 in the meantime until this pandemic is officially over, and maybe they could start going back to work, because we gotta put back our economy. We're not a dependency economy. We're not Europe. We're not a country like Venezuela where people live off the government. We have to go out and fend for ourselves. And this is a company a country that doesn't depend on welfare, on subsidies. So I think that this is a very dangerous slip and slope that we're in right now, in that we cannot restart the economy because people are sort of getting used to this dependency of getting this money every week or every month that they don't want to go back to work, and that's something that hasn't happened in America since at least that I know of, and it's something that shouldn't happen. I think that there's going to be more pandemics to come. We've had many pandemics. We had the avian flu, we had the bird flu, we had others, we had SARS, we had other 18 other viruses, and we've had a Spanish flu for 100 years. So these things don't go away, and people get sick, and we cannot sit at home and say we're going to wait for this to fly over and to go away. It's not going to go away. It's here to stay, and we're going to have to live with it. And part of it is restarting the economy, because a lot of people are getting sick because they're not visiting their hospitals, they're not seeing their therapists, they're not seeing their psychiatrists, and it's actually getting more dangerous for those that don't see their doctors than those who stay at home, avoiding not getting this flu when most people are asymptomatic and probably already got it.
If there were another pandemic and you were in Congress, or if you were in Congress during this pandemic, let's pivot to the health and well-being of Americans' health and well-being. What guidance would you be giving leadership all the way up to the White House in terms of how to handle this pandemic, health-wise, policy-wise, in terms of treatment, in terms of medication, in terms of the provision of PPE? I think we have read that people seem to be confused, at least early on, about instructions they were getting: mask, this drug works, so on and so forth, coming directly from leadership. What would you, maybe I should ask you, can you assess the national response at the federal level to COVID-19? Did something need to be done differently? Did the feds do a good job? Mr. Field, and please be brief, I ask all the candidates.
Well, the first thing is not to politicize this, because we've had a drug that does treat this, a medicine that does treat COVID-19. It's called hydroxychloroquine, and of course, since President Trump mentioned it, now all of a sudden it's the boogeyman. Now no doctors want to prescribe it, no hospitals want to prescribe it. Some states banned it. And I think it's really unfortunate, because if that could save lives, then why are they playing politics with medicine? I think that's the first thing, is take the politics out of it. And secondly is we can't shut down the economy. Look, if you could go to Publix, if you could go to Winn-Dixie, Home Depot, and stay 6 feet apart and wear a mask, then you could do that at your regular job. Okay, as a matter of fact, probably your job has a lot less people and you'll be a lot safer. We shouldn't shut down the economy. If you want to apply some social distancing guidelines, that's fine during a pandemic. But to say we're going to shut down everything and everybody stay at home and nobody work and everybody get some kind of a monthly check or weekly check, I think that's very dangerous, and that's one thing we should never do again. And I think it's unfortunate that Dr. Fauci played so much politics with the president and made him shut down the entire economy. I think some of the flights were okay, for example, from China at the time, to shut those down, to shut down some of the European flights, but to shut down the entire economy, I think we learned our lesson. We can't ever do that again.
Given the surge, and I will get to the other two candidates, given the surge in coronavirus cases and the surge in deaths, do you think that the country, despite the need to jumpstart the economy, did we reopen too early?
I think we've had many surges before that nobody ever paid any attention to. For example, the Spanish flu. Every year we have thousands of cases of Spanish flu, and nobody shuts down the country over that. And it's actually more dangerous than coronavirus. We had SARS under Obama. He didn't shut down the economy. We had the Spanish. We had SARS. We had bird flu, avian flu. We had all kinds of different coronaviruses. So what I'm trying to say is, if we don't shut down for another pandemic, why are we shutting down for? I'm not saying not to do it for this one, but I'm saying for the future. You were asking about future ones, and now you're asking me about the past one. I think that in the future we should learn from the social guidelines. We should learn that we shouldn't politicize it, and we should learn that we should just practice social distancing and safety guidelines. Now, what happened in this one, it already happened.
You tell us this before. I would
Okay.
like to make sure our other candidates get a chance to speak.
Of course.
Thank you. Ms. Salazar?
I believe that we should have put a lot more responsibility on the individual. And at the local level, I would have, and I'm not mayor and I'm not running for a local office, but I think the state, starting with the governor, we should have implemented very strict fines, very high fines, and sent the message to the population and to every individual in South Florida that we needed to keep social distance and that we needed to wear a mask. If they caught you not wearing a mask, that was going to be capital punishment. I mean, I'm being exaggerating, but that would have brought a great fine or even another type of punishment. That would have sent the message to everybody that those who wanted to go out because they didn't, they wanted to be exposed to the environment or to people that needed to wear that mask, but that the responsibility was on them. We did not send a very strong and clear signal to the individual that this was a national emergency and that emergency measures needed to be in place.
There should have been a mask mandate from the state level?
A national, the state and the federal government should have implemented a national mandate that everybody needed to wear a mask. I also have to say that this was a different type of virus, something new for its politicians and for the scientists, that at some point, people in Washington, the scientists, the medical aspect or the medical group of people that were handling or were advising the president, starting with the coronavirus task force, they didn't know about the effects or the benefits of wearing a mask. But once we knew that was the only thing or one of the few things we could do in order to stop the spread, then that should have been extremely important to stress, and something that I think that I would have done if I would have been advising the president. Because we know that three things are important: the mask, not touching your face, and social distancing. That doesn't cost any money. It's just willingness.
Thank you very much. Mr. Molina, what guidance would you have given federal leaders, including the president, in handling the coronavirus pandemic?
Well, fundamentally, the only way that I see that this pandemic will be controlled is by the personal behavior of our citizens. People have to become responsible with themselves and others. You gotta keep your distance. The mask issue is one that there are two versions of wearing the mask. You know, some people, scientists, doctors say that the mask does not resolve the problem. Others say yes, they do resolve. I am very weary about the federal government dictating me what to do. In general sense, I presume, first of all, at this point, I don't think there's anybody in the federal government that knows what the hell is going to resolve the problem. The only thing that has a possibility of stopping this pandemic is coming up with a vaccine or some sort of a medicine. Other issues and things are just guess and politics that are being interjected into this issue. Reality is that nobody knows how to stop it. And we are coming up with restrictions that are affecting our economy. And we cannot allow this to continue to restrict the development of the economy, and our fundamental and most important issue is to have a strong economy so that we can deal simultaneously not only with the pandemic, but with the different threats that we have in the world: China, Russia, Venezuela, people infiltrating in this country, trying to upset and destabilize the country. We need resources. And we have to obviously be aware of the issue of the coronavirus that is affecting, but there's got to be a balance, and we're going to have to face the music that the Almighty has given. We have a pandemic. We have to recognize that. We have to educate people to being more responsible in their mix with the society that they live in. And
Mr. Molina, we're going to move on. Thank you very, very much. I appreciate that. Let's talk about transportation. It is an issue and a challenge for this community. I don't doubt it's an issue. If your district is in Miami-Dade, then it's an issue in your
Yes,
district
it is.
and also nationwide. There have always been complaints that, especially from Representative Diaz-Balart, that this community, county government, does not have a plan to send him to walk through the process. What would you do to bring money home for transportation, to make sure people can get from point A to point B without having to get into their cars? Ms. Salazar?
You need a woman in the midst of it, because you have a lot of men in the different authorities trying to impose their own agendas, and exactly what you just said, Nancy. That Mary Diaz-Balart has said many times that we as a community, or as political leaders, or as elected officials, they need to put together a plan, a master plan, so we can take to Washington and we can get the federal dollars. So the only thing I can think of is having a very strong congresswoman that wants to join those elected officials and make them understand that we need to agree on a master plan so we can have the feds funded, or at least help us build them. So I think that maybe it's just a matter of changing genders and having a female in the meeting and helping those men reach a decision.
Okay, thank you. Mr. DeFiel?
Yeah. Well, first of all, I wouldn't play gender.
You're on mute?
Oh, I'm sorry. I muted just to be polite. Well, first of all, I wouldn't play gender politics. Number one. Number two, this area has been in. We've had a woman in Congress for 30 years, 28 years with Ileana Ros-Lehtinen, and now another 2 with Shalala. So you're not changing genders. You're just a continuation of what's already there. They haven't resolved the issue, and the issue has to be that. We have to tell the people that handle the Miami-Dade transportation, if they want the federal dollars, then we have to get results. And one of the results that I would ask for would be we still don't have a mass transit system that goes east to west. We have one that goes north to south, but we don't have one that goes east to west. We have Tri-Rail, we have Metro Rail, we have that Virgin line. But we have zero that goes out from downtown Miami out to West Kendall, out to Miami International Mall. We don't have one that services that, and we have enough space to do it over 836. And I just don't understand, after so many years of Metro Rail, because I think it's almost 40 years we've had Metro Rail, and billions of dollars that we spent on it, and yet we still don't have an east to west route. I think it's wrong, and when I'm in Congress, I'm going to press whoever's mayor that we need an east-west route, and that's one of the things I'm going to ask for.
Thank you. Mr. Molina, how would you bring federal transportation funds home to help improve people's ability to get around this community?
Well, look, I'm the only candidate in this panel that has any idea of how to approach problems of this nature, infrastructure problems. I've financed projects of trains, underground trains in Sao Paulo, Brazil. And what it did, and fundamentally I disagree with the other candidate that you need a female to solve the problem. No, not necessarily. They're very talented you gotta put a team together. You gotta come up with a solution. That has been neglected for years in that district. The problems that we're facing today is the result of the lack of vision of the previous and present leaders of different Congress districts. They have not paid attention. There's a tremendous negligence that has accumulated problems of all kinds in that district. I would put a team together of the top, first of all, I would call for engineering companies throughout the world to come up and make proposals. Then we have to select the most qualified engineering company that proposes the solution that is applicable to the district, because there's all kinds of elements that you have to take into consideration when you look for a solution that we don't have and we haven't had. So it's a fundamental issue to come together with defining what the needs are, so that engineering companies in the U.S. and abroad to make presentations, and then we have to evaluate which are the best solutions, the most economic solutions to apply to resolving the fundamental problem of
Thank you very
transportation.
much. All right, thank you. Ms. Salazar, are you playing gender politics? To Mr. Fields' point, women have filled this seat, this particular seat, for what, almost 3 decades, maybe?
Well, yeah, but I was saying that maybe maybe that it's time to have a stronger woman, because what you said is that we have not been able to really find a solution to put every man in the room together and come up with a plan. I believe that we need to find a study. I think that we have to study what's the situation. We need to hire the best engineers, but at the end, we have done all that. And the bottom line is that we have not been able to come up with a common plan. And that is something that is very frustrating for everybody, and for those people that need to be, they spend more time in their cars than with their children. And we understand that is a big problem along with senior housing, but absolutely. So what do we need to do? It's a human factor that we need to put together and try to convince those males, and that we need to do something that has not happened. So maybe a strong female like me could help them solve the problem and deal with the egos.
Can I rebut? Because she did. She had a rebuttal. Can I have a rebuttal, please?
Yeah, go ahead.
Okay.
I didn't really, it has to be brief. 'Cause
Yeah, I'll be brief. Both my opponents are talking about this as if they were running for mayor. It's not up to a congressional candidate or a congressperson to come up with bids and to put together teams. That's what the mayors and what the commissioners do. The first thing you have to do if you're running for Congress is know exactly what your role is, and your role is to bring in federal dollars. And with those federal dollars, you could ask them to do this or to do that, but that's not your job. Is to bring in bids and to bring in architects, to bring in different people from different countries. That's what the mayor does, and that's what the commissioners do. So if you're going to do that, then you're running for the wrong thing.
Thank you very much. Let's talk about health. No, we're moving on, Mr. Molina. We're moving on. Let's talk about healthcare and what needs to happen to actually provide healthcare for the millions of uninsured in this country. There have been repeated attempts, of course, to eliminate Obamacare. At the same time that this community in South Florida is pretty much ground zero in terms of enrollment in Obamacare. So clearly the need is there. What should happen here? How should people best be covered by health insurance? And so they can get at least preventive care instead of waiting to get the most expensive care, which hostages in an emergency room. Mr. Molina, briefly?
Well, to answer that question, the reason why Obamacare has not gotten the support or the enrollment that was expected is fundamentally because it's not working. So there is a Republican plan to substitute the Obamacare. And the answers are there in that plan that I am supporting. Fundamentally, we need to make available health care to everybody in this country. But it's got to be done in a manner that will not bankrupt our nation and provide the necessary services as required and needed to the majority of the people, to all the people, not the majority, but to all the people. But the solution is fundamentally in working out, first of all, bringing down the cost of medicine. That has to start from that point, because medicine is skyrocketing. We need to control. I think that there's tremendous abuse in the healthcare system that has to be looked into very carefully and brought down, and saving the money that are, because the tremendous abuse of the different, hospitals, doctors, and people involved in the health care has to be cut down, brought down to the exact needs, and have that extra money that we can save in making more services available for the people that are needed, and to cover as much of our population as we can.
Okay, thank you very much. We're gonna move on. Mr. Field,
Yes. Okay. I think that what we need to look at is what happened before Obamacare. Before Obamacare, 85% of the population was covered by some sort of either Medicare, Medicaid, or insurance company, leaving 15% non-insured. Of those 15%, half of them were under age 26. The other half of the other half, or roughly 3.5%, were people that could afford insurance but simply chose not to buy it, and then leaving about 3.5 to 4% of people who actually, for some reason, fell through the cracks, couldn't afford it, couldn't get insurance. I think if we had focused on